What if losing your erection during intimacy has nothing to do with your age, but is actually caused by 8 simple mistakes you're making that can be fixed right away? Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. I have over 10 years of experience helping men over 50 maintain strong, lasting erections throughout intimacy. Today, I'm going to reveal the real reasons you're losing your erection mid-encounter, and more importantly, the 8 fast solutions that work immediately. Here's something most men don't realize. Research shows that losing an erection during sex is incredibly common. Studies indicate that erectile dysfunction affects 18% to 47% of men in America. And for many of them, the first symptom isn't an inability to get hard. It's losing firmness during the act itself. The good news? In most cases, this can be completely fixed without medications or surgery. These 8 solutions target the real causes, and you can start applying them tonight. Before we dive into the details, please hit the like button right now. Write in the comments where you're watching from, and subscribe so you don't miss strategies for men over 50 who want confidence in the bedroom. Now, let me show you why you're losing your erection, and how to stop it. Before I give you the 8 solutions, you need to understand what's actually happening when you lose an erection. An erection requires 3 things to work together perfectly. 1. Blood must flow rapidly into the penis through the arteries. 2. That blood must fill the spongy chambers called the corpora cavernosa. 3. The veins that normally drain blood out must be compressed and closed so the blood stays inside. When you lose your erection during sex, it happens because blood is leaking out faster than it's flowing in. This is called venous leak, and research shows you only need to lose about 15% of smooth muscle function in the corpora cavernosa for noticeable venous leakage to occur. Think of it like trying to fill a bucket with a hole in the bottom. If the water is leaking out as fast as you're pouring it in, the bucket will never fill. The penis works the same way. If blood is leaking from the veins as fast as it's entering from the arteries, the erection collapses. There are 3 main categories of causes. Physical causes, like poor circulation, weak pelvic floor muscles, or medication side effects. Psychological causes, like performance anxiety, stress, or relationship issues. Lifestyle causes, like smoking, excessive alcohol, or poor fitness. I had a 59-year-old patient who came in frustrated. He said, "I can get an erection at first, but I lose it within minutes, every time." After reviewing his habits, we found 5 fixable problems. Within 3 weeks of applying the corrections, he was consistently maintaining strong erections throughout intimacy. The key is identifying which causes apply specifically to you, and fixing them systematically. If this makes sense, hit the like button and leave a comment. Solution number 1. Stop the performance anxiety cycle. This is the biggest cause of mid-encounter erection loss, especially for men over 50. Here's what happens. The first time you lose an erection during sex, it's embarrassing. Your brain remembers it. The next time you have sex, you're anxious that it might happen again. That anxiety activates your sympathetic nervous system, your fight or flight response. When your sympathetic system is activated, blood vessels constrict. Blood flow to the penis decreases. The erection weakens. This makes losing your erection again more likely, which increases your anxiety the next time. It's a vicious cycle. Research confirms that psychological factors, including depression, anxiety, low self-esteem, stress, and relationship problems, can trigger erectile dysfunction or make symptoms worse. The solution is mental reframing. First, understand that occasionally losing an erection is completely normal. It happens to every man at some point. It doesn't mean you're broken or that something is seriously wrong. Second, talk openly with your partner before intimacy. Say something like, "If I lose my erection tonight, it's not about you. I'm working on some circulation issues. Let's just enjoy being close." This removes the pressure and significantly reduces anxiety. Third, focus on pleasure, not performance. Stop thinking about maintaining your erection and start focusing on the sensations you're feeling. Paradoxically, the less you worry about your erection, the better it stays. One of my patients applied this mental shift and told his partner about his fears openly. Within 2 weeks, his anxiety dropped and his erections became consistently strong throughout intimacy. He said, "Just talking about it removed 90% of the pressure." Mental reframing is fast, free, and incredibly effective. Write in the comments, does performance anxiety affect you? Solution number 2, strengthen your pelvic floor. Immediately. Weak pelvic floor muscles are a major cause of venous leak and erection loss. Your pelvic floor muscles, specifically the bulbospongiosus and ischiocavernosus muscles, compress the veins that drain blood from the penis. When these muscles are weak, they can't maintain enough pressure to keep the veins closed. Blood leaks out and you lose your erection. Research shows that excessive or chronic tension in the pelvic floor muscles can limit arterial blood flow, and this reduces erectile function. The solution is daily Kegel exercises. Here's the exact protocol. Contract the muscles you use to stop urination midstream. Hold that contraction for 5 seconds. Relax completely for 5 seconds. Repeat 10 to 15 times. Do this routine 3 times daily, morning, afternoon, and evening. You can do Kegels anywhere, sitting at your desk, driving, watching TV. No one will know you're doing them. Within 2 to 4 weeks of consistent practice, your pelvic floor muscles will strengthen noticeably, and this will dramatically improve your ability to trap blood and maintain erections. One of my patients started daily Kegels and combined them with perineal massage that we discussed in a previous video. After 5 weeks, he went from losing his erection within minutes to maintaining a strong erection for 15 minutes or more consistently. Pelvic floor strength is essential. Start today. Solution number 3, check your medications immediately. Many common medications cause erection problems as a side effect, and most doctors don't warn you. Medications that commonly cause erection loss include antidepressants, especially SSRIs like fluoxetine and sertraline, blood pressure medications, especially beta blockers and thiazide diuretics, antihistamines used for allergies, some prostate medications. Studies confirm that medications can affect sexual arousal and reduce overall sexual function, making it harder to maintain erections. The solution is to review your medications with your doctor. Make a list of every medication and supplement you're taking. Schedule a dedicated appointment to discuss sexual side effects. Ask if there are alternative medications with fewer sexual effects. Never stop taking prescribed medications without consulting your doctor first. But in many cases, your doctor can switch you to another drug in the same class that doesn't affect erectile function. One of my patients was taking a beta blocker for blood pressure, and it was destroying his erections. His cardiologist switched him to an ACE inhibitor. Within 3 weeks, his erectile function returned completely. He said, "I had no idea the blood pressure drug was the problem. A simple medication review can fix the issue immediately." Solution number 4, stop drinking alcohol before sex. This is one of the easiest, fastest solutions, and most men don't realize how important it is. Alcohol is a central nervous system depressant. In moderate to high amounts, it impairs nerve signals between your brain and your penis. It also causes blood vessels throughout your body to dilate. That might sound good, but it actually lowers blood pressure and makes it harder to maintain the high pressure required inside the penis. Research shows that substances affecting and suppressing the central nervous system can cause serious damage to blood vessels, and this leads to erectile dysfunction. While one drink might relax you and reduce performance anxiety, 2 or more drinks work against your erection. The solution is simple. Limit alcohol to 1 drink maximum, at least 2 hours before intimacy. Or better yet, abstain from alcohol completely on nights you're planning to be intimate. If you want the relaxing effect without weakening your erection, try deep breathing exercises or a warm shower instead. One of my patients was accustomed to having 2 to 3 glasses of wine with dinner before intimacy. When he stopped drinking alcohol on nights he planned to be intimate, his erections became significantly stronger and lasted much longer. He said, "I thought the alcohol was relaxing me. I didn't know it was actually destroying my performance." Skip the alcohol. Your erection will thank you. Solution number 5, use continuous stimulation the entire time. Many men stop stimulation once penetration begins. This is a big mistake. Your erection needs continuous arousal signals from your brain to your penis. When stimulation stops, those signals weaken. Blood flow decreases. The erection softens. Research shows that arousal and stimulation trigger the brain to release impulses necessary to maintain increased blood flow for erections. The solution is continuous engagement during intercourse. Maintain mental and physical stimulation. Talk to your partner, make eye contact, touch her body, focus on pleasurable sensations. Don't let your mind wander to work, stress, or unrelated thoughts. If you feel your erection weakening, don't panic. Just stop penetration and return to manual or oral stimulation until firmness returns. Then continue. Changing positions also provides a brief break that can help restore firmness if needed. One of my patients noticed he was mentally disconnecting during sex and thinking about his to-do list. When he focused intensely on staying mentally present and engaged, his erection remained consistently strong throughout intimacy. Continuous stimulation and mental engagement are essential. Solution number 6. Switch to better positions. Certain sexual positions make maintaining an erection much harder, especially for men over 50. Positions requiring significant physical effort, like supporting your body weight in a push-up position during missionary, divert blood flow and energy away from your penis to your arms, chest, and core. When you're physically exhausted, your erection suffers. Positions where you're standing also make things harder because your heart has to pump blood upward against gravity. The solution is choosing positions strategically. Choose positions where you're relaxed and not supporting your body weight. Woman on top is excellent because you're lying down and relaxed. Spooning or side-by-side positions work well. Modified missionary, where you support your weight on your knees instead of your arms, is better than traditional missionary. Avoid standing positions completely if you're having trouble maintaining erections. One of my patients always used traditional missionary, and it exhausted him within minutes. After switching to woman on top and spooning positions, he maintained strong erections throughout intimacy consistently. He said, "I didn't realize the physical effort was affecting my erection that much. Position matters more than you think." Solution number 7. Treat chronic diseases. Uncontrolled diabetes, high blood pressure, high cholesterol, and obesity all directly damage blood vessels and erectile function. Research shows that men with obesity are 3 times more likely to develop sexual dysfunction, and the prevalence of erectile dysfunction increases from 8% in men aged 40-49 to about 78% in men 75 and older, largely due to accumulated vascular damage. High blood sugar damages nerves and blood vessels. High blood pressure hardens arteries. High cholesterol clogs blood vessels. Obesity lowers testosterone and increases inflammation. The solution requires medical management. If you have diabetes, work with your doctor to tightly regulate blood sugar and target an A1C under 7%. If you have high blood pressure, ensure it's properly controlled with medications and lifestyle changes. If you have high cholesterol, take a statin if recommended and improve your diet. If you're overweight, commit to losing even 10% of your body weight through diet and exercise. Studies show that lifestyle changes, including weight loss and increased physical activity, can significantly improve erectile function. One of my patients had uncontrolled diabetes with an A1C at 9.2%. After working with his endocrinologist to bring it down to 6.8% over 6 months, his erectile function improved dramatically. He said, "Fixing my diabetes fixed my erections. It took time, but it worked." Managing chronic disease isn't fast, but it's essential for long-term erectile health. Solution number 8. Stop smoking and start moving. This is the lifestyle foundation everything else builds on. Smoking damages blood vessels throughout your body, including in your penis. Nicotine constricts blood vessels and reduces blood flow. Research shows that men who took nicotine showed a reduced erection response, demonstrating that smoking directly impairs erectile function. Physical inactivity leads to poor cardiovascular fitness, reduced blood flow, and weak erections. A 2011 meta-analysis found that aerobic exercise is associated with significant improvement in erectile dysfunction symptoms. The solution has two parts. First, stop smoking completely. Use nicotine replacement therapy, prescription medications, or smoking cessation programs. Within weeks of quitting, vascular function begins to improve. Second, start exercising regularly. Aim for 30 minutes of moderate aerobic activity. Walking, jogging, cycling, 5 days per week. This improves cardiovascular health, increases nitric oxide production, and enhances overall blood flow. One of my patients smoked a pack a day and was completely sedentary. After quitting smoking and starting a daily walking routine, his erectile function gradually improved over 3 months. By the 4th month, he was maintaining strong erections throughout intimacy consistently. Stop smoking and start moving. These are non-negotiable for long-term erectile health. Let me give you an action plan to apply all 8 solutions systematically. Immediate actions. Tonight. Address performance anxiety through reframing and communication with your partner. Stop drinking alcohol before intimacy. Use continuous stimulation and better positions during intimacy. Daily actions. Starting tomorrow. Start Kegel exercises. 3 sets of 10-15 daily. Start walking 30 minutes daily. If you smoke, start your quit plan immediately. This week, schedule a medication review with your doctor. Get blood work to check blood sugar, cholesterol, and testosterone. This month, continue Kegels and exercise consistently. Work with your doctor to improve management of chronic diseases. Track your progress. Note frequency of erection loss and overall sexual satisfaction. Most men see noticeable improvement within 2 to 4 weeks of applying these solutions. By 8 to 12 weeks, erectile function usually stabilizes significantly. One of my patients applied all 8 solutions systematically. At his 3-month follow-up, he reported 0 episodes of erection loss in the past 6 weeks, and described the best sexual confidence and performance he'd ever had. This systematic approach works. Here's what you need to understand. Losing your erection during sex is very common, affecting 18% to 47% of men. The main cause is venous leak, where blood leaks out faster than it flows in. It only takes losing 15% of smooth muscle function for symptoms to occur. The 8 fast solutions are: 1. Stop the performance anxiety cycle through mental reframing and communication. 2. Strengthen pelvic floor muscles with daily Kegels. 3. Check your medications for sexual side effects. 4. Stop drinking alcohol before intimacy. 5. Use continuous stimulation throughout intimacy. 6. Switch to better positions that don't exhaust you. 7. Treat chronic diseases like diabetes and high blood pressure. 8. Stop smoking and start regular exercise. These solutions target the real physical, psychological, and lifestyle causes of erection loss. Most are free, simple, and produce results within weeks. Starting tonight, apply the immediate solutions. Starting tomorrow, begin the daily practices. This week, address medications and health screenings. This month, commit to the full protocol. Within weeks, you'll maintain strong, lasting erections throughout intimacy, consistently. If this video helped you, hit the like button right now. Write in the comments and tell me which solution you'll start with first. And subscribe for more science-based strategies for men over 50. Losing your erection during intimacy can be fixed. You don't have to live with it. Apply these 8 solutions, stay firm, and always remember, take care of yourself because you're worth it.